compression. All right, pretty easy. I'm gonna go over task and standards here. Any questions, don't be afraid to ask at the end, all right? All right, your task, treat a chest wound and tension pneumothorax. Condition, you are a member of the team on a combat patrol that has come under small arms fire in a non-CBRN environment. You witness a teammate in the open receive a gunshot wound to the upper body. Your teammate was able to move to you and is responsive. You are behind cover and not under hostile fire. Security has been established. You must begin treatment while waiting on medical personnel to arrive. Casualty is alert and complaining of difficulty breathing. Another soldier is helping you finish the casualty assessment and is obtaining the other vital signs. Standard, perform all tasks to standard in sequence within 10 minutes without causing further injury. What you need to take away from that is the casualty is alert. When you go into writing down AFU on your TCCC card, he is alert because he is responding to you and able to move around. All right. Another one you need to take away is you have a battle buddy giving you a hand. So once you need to get out an occlusive dressing and some stuff to clean the chest wound, you can have your battle buddy apply pressure to the wound while you do that. All right. Everyone understand so far? Any questions so far? Sick. All right, first things first, before we even start the lane, you are going to inspect your equipment to make sure everything is in there. Because you're going to have 2 occlusive dressings, 1 needle D, roll of tape, alcohol wipes, a TCCC card, map marker, and also a O2 sensor that we jury rigged with as a splint instead, because we don't have it. All right. On that splint O2 sensor is going to be your heart rate and the ox level for the casualty. All right. You're not going to change really. It's going to be 110 the heart rate. It's going to be 70 the O2 level. You still need to write those on the card. All right. All right. First things first. We are going to apply an occlusive dressing. What you need to do is expose and assess the injury. To do that, you're going to take the flick off without causing further injury to the casualty. There are 4 buckles. Take it off, keep it in your workspace, so that way you can get at the IFAK and still continue to work. Next, you're going to undo the blouse and find the injury. It will be a dot or an X on the dummy. You're going to apply pressure. Once you apply pressure, you're going to ask your battle buddy to assist you and apply pressure.
You apply pressure.
Now you're going into your IFAK and you're getting out the equipment you need to apply occlusive dressing. You're going to need your gauze, a hemostatic dressing. Alright? First things first, you're going to get the gauze. Ask your buddy to release pressure, clean the dirt and fluids.
Reapply pressure.
And then have them reapply pressure. Once that is done, you're going to get out your occlusive dressing. You're going to apply it halfway. Ask your battle buddy to release pressure, wait on the exhale, and apply the dressing the rest of the way. Once it's applied, you're going to measure around the wound roughly 2 to 3 inches using 3 fingers to ensure the wound is fully covered by the hemostatic dressing. Next, you're going to log roll the casualty. The way you're going to do this is the arm on the non-injured side is going above his head. The injured side leg is going to be raised up, and then you're going to go under the neck with your right arm, grab the waist with your left, and roll him towards you. So apply the same steps. You see the wound, you apply pressure. Then you're going to have your battle buddy apply pressure.
Apply pressure.
And you get out your equipment. And you get out your gauze. And you're going to do the same thing. Cleaning for dirt and debris.
Fluids. Reapply pressure.
Have them reapply pressure. Hemostatic dressing. Go halfway with it. Have them release pressure. On the exhale, apply the dressing all the way down. When the dressing is done, you're going to measure 2 to 3 inches all around the wound. Make sure it's fully covered. push his dummy gently down. Next, we have 5 questions. You only need 3 of them. We're going to give you the easiest ones that roll right into each other. Your first thing you need to ask the dummy is if he is having difficulty breathing.
Do you have any difficulty breathing?
We will reply, he is having difficulty breathing and pain on the wounded side. The next step is to check for even rise and fall of the chest.
Looking for even rise and fall of the chest.
All right, you observe uneven rise and fall of the chest, and the abdomen is distended. The next step is to look for bluish skin.
Looking for bluish skin.
You observe mild cyanosis. All right, they go right into each other, okay? He's having difficulty breathing, so I'm going to check his chest for even rise in the fall. He has uneven rise in the fall, and his abdomen is distended. Now I'm going to look for bluish skin. That means he has poor circulation because he's not breathing well. They all roll right into each other. All right. The next step, you are going to go into the needle decompression portion. First thing you're gonna do, grab the arm on the opposite side of the wound, bring it over into his armpit. Your index finger should line up with the indent of the armpit, and where your pinky is should be the 4th and 4/5 intercostal space. Once you found that area, you're going to memorize it and you're going to clean with an alcohol wipe. Then you're going to insert the needle at a 90-degree angle to the chest wall. As you insert the needle, make sure you don't bend the needle. All right, it's not going in super far. Once your needle is inserted, the grader will state you hear a pop. Now you will verbalize waiting 5 to 10 seconds.
Waiting 5 to 10 seconds.
Once time has elapsed, you will remove the needle and put the needle away. The next step is to get the tape. You're going to get about an inch of tape and rip it off. Then, once you have the tape, you're going to rip it in half about halfway down to make pants. Once you have the pants, you're going to use them to help secure the catheter to the cavity. You're going to go put the catheter in the rip, and then you're going to cross the legs of the pants to secure the catheter. All right. Once you're done that, you're going to get your O2 sensor out of your IFAP. Have another alcohol wipe. You should get your TCCC card and your MET mark at the same time. All right. Once you have them, you're going to clean off your finger. It's to simulate the casualty's fingers. Put on the O2 sensor and look at the time on your watch. The watch is part of the EIB uniform. If you do not have it, on test day, there's a no-go. If you have the time and the O2 stats, you're going to get to the TCCC card. You're going to begin filling it out. First thing you should fill out is on the bottom of the front where the signs and symptoms are. You're going to fill that out. You're going to fill out signs and symptoms. You can go in order. The time, you're going to write the current time with a lima at the end for local time. You're then going to fill out the pulse rate and location. The pulse rate and the O2 levels are on our makeshift O2 sensor. You're going to put the pulse rate, which is right now 110, and the location, which is Romeo, for radial pulse. Alright? The next step to fill out the pulse ox, or pulse stat, which is 7-day currency. Then underneath that is ABFU, and he's alert, right? So you put A for alert. Then you're going to start filling out the rest of the TCCC card. All the admin data is filled out, like battle roster, his name, gender, allergy, service, and unit. All that's already filled out. You don't need to worry about that. First thing you're going to do is evac. Start from the top down. Evac type. He's urgent. He can't breathe. Or he needs to go to the hospital ASAP. Alright? Next, you're going to put the date and time. The date, it has an example right there. 05 NOV 25. Okay? month, year. And then you put the time, which is now the current time, which is a little different from the O2 stat. It'll be a few minutes different. And that's why you have a watch. Put down the correct time. Put down the time, there's another lima at the end. Next, on the injury, right? Negative of injury, sorry. There's GSW. He got shot, a gunshot wound. You gotta check that off. On the outline of the casualty, you're going to mark out with an X where he's injured. You're not just going to circle the number. You're going to mark where he's injured with an X. Same thing on the back side of the casualty. You're going to mark where he's injured with an X. With that done, you twist the card over, press it on the back side. You think you have to fill out. You gotta type again. Urgent on the top. Then you're going to mark what you've done for the casualty. You've only done two things. The needle beam and the chest seal. Not be checking off just two, and not do one. Alright, so you gotta pay attention to what you're marking. After that, the last step of this is just your first and last name and your last four. You don't need your last four, you just need four numbers. Once the T-Triple-C card is filled out, you're going to tape it to the casualty on the non-injured side. Once it's taped, your time is done. You have plenty of time. It's 10 minutes long.